Hello, good afternoon, everyone. I am glad you're here and you're joining us today. This webinar is Policy in Action, State Level Innovation with Deaf and Hard of Hearing Job Seekers at American Job Centers, or the LEAD Center. And you can move to the next slide, please. And I am so happy that you're joining us today. My name is Sarah Loazo, and I am a subject matter expert on career pathways for the LEAD Center, and I'm part of the National Disability Institute. I will be the facilitator for today's webinar, and we have a really great lineup that I'm really excited to hear from. And so let's just get started. Next slide, please. So we want to make sure everyone can fully participate in today's webinar. So I'm just going to take a minute to share a few housekeeping tips. This webinar today is live captioned, and the captions appear below the slide deck. You also have the option to open the captioning webpage in a new browser, and the links have been posted in the chat or will be momentarily. Once the captioning window opens on your own system, you can adjust the background color, the text color, and the fonts using the drop-down menus at the top of the browser window. We suggest you position the window to sit right on top of the embedded captioning to allow you to see the screen itself. This webinar is being recorded, and the archived webinar with supporting materials will be placed on the LEAD Center website under recent and upcoming events within 10 business days. Next slide, please. We love questions, and we highly encourage you to, as this event goes on, asking questions that anyone that you might have to cover today. You can see at the bottom of the screen, there are two boxes. One is for chat and one is for Q&A. If you have a question regarding technical, you're having a hard time seeing or hearing or have a technical question, please feel free to put that question in the chat box. If you have a question based on anything that you hear today from the presenters, please post that question in the question and answer box. Some of the presenters today will be able to answer questions throughout, but we are going to try to save time towards the end to answer at least a few of the questions. And so, without further ado, thank you. I am happy to introduce Tawny Holmes Leibach, Esquire, White House Fellow. She is originally from West Palm Beach, Florida, and is currently placed at the Office of Disability Employment Policy at the U.S. Department of Labor. As a third-generation deaf person and attorney, she is a dedicated advocate for deaf children's education with lifelong success in mind. Tawny is a tenured associate professor in deaf studies at the world's only university for the deaf, Gallaudet University, where she recently won $3.75 million in funding to lead a national implementation and change center for early intervention with deaf babies and their families in partnership with HRSA and NICHQ. Tawny's also served as the executive director of the Conference of Educational Administrators of Schools and Programs for the Deaf. And I am pleased to have her give us our opening remarks, and then we will also hear from her a little later. So Tawny, I will hand things over to you.
Thank you, Sarah, for the very nice introduction. Again, my name is Tawny Holmes Leibach. I am a White House Fellow at the U.S. Department of Labor's Office of Disability Employment Policy, or ODEP. Thank you for attending today's LEAD Center webinar on Policy in Action, State-Level Innovation with Deaf and Hard of Hearing Job Seekers at American Job Centers, also known as AJCs. Next slide. I want to talk a little bit about ODEP. ODEP is authorized by law to provide leadership, develop policy and initiatives, and award grants, furthering the objective of eliminating barriers to the training and employment of people with disabilities. Next slide. Bottom line, the objective of ODEP is to assist workforce systems, including states and employers, in adopting policies and practices that increase employment opportunities for people with disabilities, including those with significant disabilities, with the aim of promoting employment and independence and reducing reliance on federal benefit programs. On a personal level, I am a third generation deaf person, and I come from a family of hardworking deaf adults. My father was a carpenter, and my mother worked a variety of jobs, from being a beautician to a data entry specialist to a home health aide. I am an attorney myself and have focused on promoting child and family-centered policy practices in early intervention, education, and employment over my career when it comes to deaf, hard of hearing, deafblind, and deaf disabled communities. I have tremendously appreciated the opportunity to learn more about the work of the federal government and its partners and grantees, including the LEAD Center, in the course of my one-year fellowship ending next month. So with that, I'm looking forward to today's webinar. The topic is aligned with the administration's priority to improve job opportunities and economic growth for all Americans, including those who are deaf and hard of hearing. By promoting innovative approaches to communication access, states are demonstrating commitment to increasing employment outcomes. We have 3 great states today with us, and many more among you, the viewers. We look forward to this dialogue being a continuing one. With that, I will turn it over to Sarah and our presenters to talk more about the innovative work that they are doing. Thank you.
Thank you so much, Tani, for sharing those opening remarks. And I agree, we have a lot of great presenters today. If we could just, I'll go back one more slide, please, quickly. Before I introduce our presenters and get started, I just want to talk a little bit about what the LEAD Center is. The LEAD Center is the National Center on Leadership for the Employment and Economic Advancement of People with Disabilities. It is a Workforce Innovation and Opportunity Act, WIOA, Technical Assistance Center, funded by the Office of Disability Employment Policy through the U.S. Department of Labor. The LEAD Center helps states, workforce development professionals, and American Job Centers implement WIOA in service to Americans with disabilities. Through its resources, tools, and technical assistance, the LEAD Center increases career pathways and economic self-sufficiency for people with disabilities. We work with people to match employers with skilled workers that they need to compete in the global economy, and improve disability data reporting by WIOA programs, and much more. And hosting great webinars like today with our great presenters. You can go to the next slide, please. We have 3 fantastic presenters today, and they've got great stuff that they're doing in their states they're going to share. First, we're going to hear from David Evans. He is a placement specialist for the Greater Los Angeles Agency on Deafness. And then we'll hear from Stacy Bragg, the Deputy Director at the Delaware Division of Department of Vocational Rehabilitation. My apologies. And last, we'll hear from Robert Cooper, the Executive Director for the Kansas Commission for the Deaf and Hard of Hearing. And Tani will also be presenting again with a great resource at the end of that. Next slide, please. Through today's webinar, or by the end of today's webinar, we hope that you will have learned how state-level leadership and coordinated efforts can improve communication access and service consistency for deaf and hard of hearing job seekers. We hope that you will learn about effective statewide strategies and partnerships that support consistent, reliable service delivery. And we hope that you will hear from these real-world examples of policy implementation, including California's work with GLAD, Kansas Communication Access Fund, and Delaware's approach to video remote interpreting. Next slide. And so we have one more presenter before we get to those. My apologies. Wanted to give a national context to all of this and how it works with policy. So we have asked Lamia Chapman, Senior Policy Advisor at the Office of Workforce Investment at the Employment and Training Administration at the Department of Labor, to share a few words before we speak with David. Lamia Chapman serves as a disability policy lead within the U.S. Department of Labor's Employment and Training Administration, their Office of Workforce Investment, where she brings expertise in disability, employment policy, and program development. In her role, Ms. Chapman leads strategic initiatives that advance workforce policies by cultivating partnerships across the Department of Labor and other federal agencies, representing the Office of Workforce Investment in cross-sector engagements and coordinating technical assistance to grantees through virtual learning events, publications, and trainings. She possesses extensive experience in grants management and risk assessment, contributing to the development of core monitoring guides, agency-wide risk assessment strategies, and the review of fraud alert processes and grant determinations. Ms. Chapman also oversees contractor supports, the creation of policy guidance, including training and employment guidance letters, also known as TEGLs, training and employment notices, also known as TENS, and frequently asked questions. Her work plays a critical role in enhancing the operational capacity of American job centers to better serve adults and youth with disabilities. Through the promotion of evidence-based practices and adaptive work strategies, she helps to ensure the workforce system remains responsive and adaptable in a dynamic labor market conditions. Lamia, we look forward to having you here today. Welcome. I will give the floor to you.
Thank you, Sarah. Thank you. Again, my name is Lamia Chapman, and I serve as the Disability Policy Lead within the Office of Workforce Investment at Department of Labor, Employment and Training Administration. ETA works in partnership with state and local workforce development boards to oversee the delivery of workforce services through 2,300 American job centers across the country. Under the Workforce Innovation Opportunity Act, WIOA, all AJCs are required to provide individuals with disability and full access to all job seekers. These centers serve as a gateway to career opportunities, training programs, and support services designed to help job seekers achieve their employment goals. Section 188 of WIOA prohibits discrimination based on disabilities. When AJCs think about how to provide services to everyone, AJCs can think through both physical and programmatic accessibility for workforce development services. Physical accessibility means that facilities are usable by individuals with a range of disabilities. Programmatic accessibility means that policies, practice, procedures provide effective and meaningful access to services and training for individuals with disabilities. Reasonable accommodations are modifications to equipment, schedules, training materials, or provision of auxiliary aids such as sign language interpreters and captioning. Besides WIOA 188, making services that are accessible and providing reasonable accommodations help AJCs be consistent with broader federal civil rights protections under the American with Disabilities Act and Section 504 of the Rehabilitation Act of 1973. Individuals who are deaf and hard of hearing can experience barriers to employment and low employment rates. Communication needs vary widely across programs, and as such, flexibility in accommodations is critical to ensure effective access. We're here today to hear from states about delivering targeted services to address the specific needs of individuals who are deaf and hard of hearing. Key areas include communication access, providing qualified sign language interpreters, real-time captioning, video relay services, and other assistive communication technology. Program accessibility, designing training workshops, and learning materials that are fully accessible to persons with disability and deaf and hard of hearing individuals. Support services, which offers case management, peer support, and access to community-based resources that empower deaf and hard of hearing job seekers. And employment assistance, which is delivering personalized employment services, including job coaching, career counseling, and placements tailored to the needs of deaf and hard of hearing individuals. I am excited to hear today how states have been working to advance accessibility across the workforce development programs. I know states are doing things like ensuring compliance with Section 188 and ADA regulations, specifically around access to communication technologies and services. They are promoting collaboration between all WIOA titles, including vocational rehabilitation programs and other service providers, to provide complementary services such as assistive technology and interpreter services. Supporting ongoing tech training for AJC staff, capacity in serving participants with disabilities effectively, and regularly certifying and physical reviewing of AJCs to uphold accessibility standards. For so many states out there, the goal is not just compliance, but the creation of a fully accessible environment where individuals who are disabled and are deaf and hard of hearing can thrive and fully participate in the workforce development opportunities. Thank you, and I hand it back off to Sarah.
Thank you, Lamia, for sharing that. I really appreciate it. Next slide, please. So without further ado, we're going to get started with our first guest presenter, who I would say actually, if you attended January's Lead Center webinar, he may seem familiar. I would like to introduce David Evans. He is a placement specialist at the Greater Los Angeles Agency on Deafness, also known as GLAD, for their Division on Employment Services. GLAD partners with the California Employment Development Department to provide employment services to deaf and hard of hearing job seekers in their service areas in Los Angeles. David enjoys reading, walking, history, museums, and cultural events, urban exploration, genealogy, and travel, and he has a wealth of knowledge on serving deaf and hard of hearing customers in American job centers. So without further ado, David, the floor is yours.
Thank you. Thank you, Sarah. Good afternoon. It's actually still morning here. No, it's not. It's afternoon. Some of you may recognize me from my webinar in January. My name is David Evans. My name is this. I'm a placement specialist at GLAD, the Greater Los Angeles Agency on Deafness, here in the Los Angeles, California area. I've worked here for over 15 years. I started with some things that you may have remembered from January. I'll repeat those things again for those that did not see my presentation then. I'll start with some of the finances here in the LA County area. We have an estimated 800,000, well, actually, no, the LA region, we have an estimated 800,000 plus deaf people who have some type of hearing loss. And following the state of California's Office of Deaf Access, ODA. Next, the Nationwide Deafness Center on Post-Secondary Outcome reported for 2018 to 2020. Wait, let me say that again. 2018 to 2022. In the state of California, they said that they estimate about 44% of deaf adults are either not working or are looking for a job. Compare that with the 26% of hearing people who are in the same situation. That means that the unemployment rate for deaf people with additional disabilities is now estimated about 28.5%. Very critical need for employment services for that population. So that is some stats I wanted to open up with. So what does that mean? That means that we have to provide equal communication access for these populations so they can achieve employment that's accessible like their hearing peers. I'm working with a PowerPoint on my own personal device. Just give me a second. So GLAD Employment Services is known as GLAD ES. We recently underwent a name change. And the way that we operate, I'm going to give you a little bit of a summary about that. We get an annual grant that's funded through the Wagner-Pazer grant in California. It's a 10% governor discretionary fund that we do get through the state of California. Some of that money, or all of it, is actually passed on through the Department of Employment. Our primary partnership here in the state of California is the California Employment Division. So that's the EDD. We also work with them for VR work, regional centers. We work with them to place employment in Goodwill centers, at the Helen Keller Center. We also work with the independent living skills centers in the area. Those are the different agencies that we work with as secondary partners. We have a structure set up with 8 offices in 4 different areas. We have 4 offices in the LA area. I'm in one of them currently. We have 2 in Orange County, and we have 2 in the Inland Empire area. That also involves Riverside County and San Bernardino County. So that's more on the eastern part of Southern California. That's who we serve. Those are the 8 offices that we have, and each office has 2, which is a total of 16 staff employed. And so what do? 2 staff in each office means 1 is a placement specialist. That would be me in my role. Typically, it's a deaf or hard of hearing individual. The second person is an interpreter, obviously, who's hearing. Each office has 2 staff that serve the population within their region. Is that clear? Great. So how does GLAD ES function? So we have offices within the area, and all of the offices are on site in an EDD office, like here. So this is the typical state office environment, like you see in my background. We don't work under GLAD itself. We go to their offices every now and then, but this is the workforce center that I work out of. We're all set up at a one-stop career center. And that's really important to highlight because we do on-the-ground collaboration with people that are actually serving the state populations for their needs. So we collaborate together with the people who are working here in EDD, GLAD. Now, the services that we provide, and keep in mind, this is a really specific type of service here in California. Some of you have seen different types of services provided by different states in the country, so it may be a different setup in your unique state. But this is something that you can see is possible for your state. This is one example of a variety of ways that you can do it. You can take these ideas and figure out how to apply it into your state. Hopefully you can give as good a service as we do. Hopefully all states can do that. In my honest opinion, all states should do this. So we provide free interpreters for interview orientation. We actually just expanded that to include interpreting services for training within a reasonable time limit. We also give job referrals. We give free use of state resources through EDD for their database on job skills and the labor market information. called LMI. We also help assist and teach one-on-one with consumers about helping them with resumes, applying for jobs, cover letters, etc. We give interview practices. We give advice on communication access on the job. We also do document translations for filing unemployment or for state disability insurance. We also give follow-up support after placement happens. Now, our consumers, they're all deaf and hard of hearing. Hearing people have their own system, their own support centers, their own agencies that they can take advantage of at any time. This program is designed for giving access primarily to deaf and hard of hearing people, especially those who use sign language to communicate. Our consumers come from a variety of backgrounds. Some come from schools for the deaf, have been signing their whole life. Others have been mainstreamed, don't know sign language at all. Some are older adults that, lost their hearing later in life. Some have moved here from other countries and are immigrants. Some are highly educated. They have their bachelor's degree, they have their master's degree, but they're deaf. So we can see there's a huge range of backgrounds. Some people have no educational background. Some people can't even read and write. So within our community, there's so many different backgrounds, ages, gender, racial identities. The one criteria that they have to get service here is deaf or hard of hearing. And then we welcome them and we try to give support. So that gives a big overview of our programs. We give support for pre-hire services. For job support, we unfortunately are not able to order companies to hire deaf employees, unfortunately. So we then advocate the best that we can for job support. We work in-house with the GLAD Advocacy Division to make sure that there's seamless support and seamless support for all the job seekers that we help. I know right now the environment has been changing. Obviously, the political climate has impacted us, and we want to share some of our best practices that we've been using that we would recommend for your own service program, either that is existing currently or that you imagine implementing in the future. Primarily, we suggest hiring deaf and hard of hearing people to help lead those programs and develop them. That's important because deaf and hard of hearing people have that lived shared experience. If I have a person sitting in front of me that is deaf, then we have a shared experience. If I'm hearing and they're deaf, then they don't have a shared experience. I don't have an innate understanding of what their life is like. I don't have the same language. I don't share that ability to directly communicate with them if I'm hearing. I may not know their regional dialect because, as you may know, sign language has regional dialects. Now, I am not trained to be a deaf interpreter, but as a deaf person, I'm able to help assist deaf people directly in a very efficient way that would be different than if I were to go to a hearing agency. That's my goal here. And that's a really important thing to emphasize. We want to make sure that deaf and hard of hearing people are centralized here in these service centers. Obviously, there are some areas that you do not have a lot of deaf people in that local area. So please don't just try to bring in a signing hearing person, bring in a deaf person to help lead and develop those programs. That's really important. Make sure your materials have captions and subtitles. Make sure you provide ASL versions of all the documents and the materials. In California, the DMV, they have the driver's license booklet. They have now translated it into ASL in the state of California. So I would suggest a similar concept for other materials that you might be producing yourself. Make sure you educate the employers about interpreting services and how important communication access is. It's not a one-size-fits-all type of concept. Each person that we see has unique communication needs. So it's important that we educate employers to ask those new employees what it is that they need to have that communication access. Maybe they're very fluent in ASL. Maybe they've just learned ASL and they have an English form of sign language that they use. Maybe they don't know ASL at all. Maybe they just moved from another country and they have a different country's sign language that they use. We will try to evaluate their needs and work together to figure out how to provide the best communication access that they could get. We also suggest working with local K through 12 and post-secondary institutions to provide services for people that are entering into the workforce. That's really important. We need to give information that they need that may have not had the experience of incidental learning, of hearing how their siblings or their parents went to college and how they went to move on to their career. So we have to step in and help bridge that gap, if you will. We provide that educational component that was perhaps missed. We use our own lived experience to say, hey, this is how I did it. Maybe this will work for you, maybe not. We also partner with local deaf and hard of hearing agencies when possible. GLAD, again, is the agency that we partner with, but there are sister agencies within the state that we work with as well. We train unemployment agency workforce centers. I often give presentations for new people to just reintroduce our program and services that we offer. Also, use social media when you can for putting the news out there for workshops and blogs. Make sure communication remains open. It's a very different world today, so prioritize the way that you can reach out to people in a variety of different ways because not everybody gets information in the same channels. So make sure you put the information out there. Zoom works well also. Also, we do a follow-up and support for 60 days after placement. I just got a heads up. I don't have much time left, but I do want to talk about some of the challenges that we have. Communication access is so important in each office. We provide interpreting services at each office, but we also supplement that with agency interpreters when we don't have enough. With job readiness, we often maintain one-on-one interactions, but we also provide workshops. We refer to outside programs that may help supplement some of our services to help develop some of those life skills to help our consumers become career ready, interpreter. We also work with the employers. A lot of deaf people don't have opportunities like hearing people. And so we try to give networking opportunities. And we try to connect our consumers with hearing employers that come from the private sector. Finally, we offer post-hire support, and we collaborate with DR to provide that 60-day follow-up support. We go to different businesses and make sure that there are no issues. If anybody reaches out to us, we typically will go in person, check into what the situation is. Was there a lack of communication, perhaps misunderstanding about job responsibilities? It's not a job shadowing, but more of problem solving. Hopefully that gives you a good idea of what it is that we offer. Feel free to ask any questions. And at the end of this, we'll send the PowerPoint and you'll see my contact information on the very last slide. Thank you for your time.
Thank you so much, David. I always learn so much when I hear from you, and you do such great work in California, and I really appreciate you sharing with us in today's webinar. I want to move to the next slide, please, and introduce you to our next guest presenter, Stacy Bragg. She is the Deputy Director for the Delaware Division of Vocational Rehabilitation. Stacy has over 28 years of experience working with individuals with disabilities. At her agency in Delaware's vocational rehabilitation, she provides individualized services to employers and people with disabilities, resulting in greater independence and a more inclusive workplace. Stacy began working in the field of vocational rehabilitation with Delaware's Division for the Visually Impaired Vocational Rehabilitation Unit for 13 years and has spent the last 15 years with Division of Vocational Rehabilitation, moving through various positions of secretary, counselor, employment specialist, district administrator, and now deputy director. Stacy is also an adjunct instructor for Delaware Technical and Community College in both the Human Services and Social Sciences programs. She holds a Master's of Science degree in Administration of Human Services from Wilmington University. Her passion is also driven to serve in this field with having a child and family members with disabilities. Stacy is also an avid supporter of Special Olympics of Delaware. Stacy, I am so excited to hear you today. Thank you for coming on, and I will hand it over to you.
Hello, everyone. I'm so excited to be here today. I'm looking forward to sharing Delaware's experience with access in the workforce system, serving deaf and hard of hearing individuals. As I mentioned, I currently hold the position of Deputy Director with Delaware's Division of Vocational Rehabilitation. It's commonly referred to as DVR, where our mission is to assist individuals with disabilities in preparation for securing and maintaining employment. We offer tailored services and guidance to those seeking work, ensuring they have access to optimal resources for education, training, support, and career services that facilitate their employment goals. Is there a next slide? Thank you. So we're going to start with a little background and statistics about Delaware's experience and what we've been doing. According to the Center for Research on Disability, the 2023 statistics indicate that Delaware is home to approximately 5,000 deaf individuals who face daily struggles to access language, information, healthcare, and skilled professionals to participate fully in all aspects of community living and work. There are approximately 33 registered interpreters for the deaf in the state to provide services to this deaf population. We recognize the shortage and need in this area. Delaware Division of Vocational Rehabilitation, as mentioned, is the general VR agency and a part of the Delaware Department of Labor. Within our agency, we have the Office of the Deaf and Hard of Hearing. This was established in 1993 to provide information, education, training, and advocacy for people who are deaf and hard of hearing. With DVR being a part of the workforce system, access has been an issue for the deaf and hard of hearing, and our call to action is to increase access here at the Department of Labor. We at DVR had one of our deaf employees, Mike Papilli. Shout out to Mike, who's likely on this call today. He is a district administrator at one of our offices here in Delaware. He did some research, and one of the identified and recommended options from his research on access was video remote interpreting, commonly known as VRI. Video remote interpreting is an interpreting services that use technology to provide sign language, ASL, sign language interpreting services on demand. VRI is a way to access interpreting services via an internet connection where participants and interpreter can see and hear each other on the screen. The connection is made through a remote or off-site interpreter through safe and secure platforms to communicate with individuals who are deaf and hard of hearing. VRI can be used for in-person or virtual meetings or on demand when needed. And this is through a paid monthly subscription for service. DVR moved forward and obtained approval from our State Department of Technology and Information office. We then went through a security process. Once approved, our team member Mike started to pilot the VRI service. We have found this service is meeting the needs and has been working well, and we are now in year 2 of utilizing the service. So a little bit about Delaware's agency structure. As mentioned, Delaware Division of Vocational Rehabilitation is the general VR agency and a part of the Department of Labor. We are co-located with our sister agencies, the Division of Employment and Training, where our American Job Centers are housed, the Unemployment Office, Industrial Affairs, Office of Labor Market Information, the Workforce Board, and Paid Family Leave. DVR successfully coordinated efforts to provide video remote ASL access to our sister agencies. With our co-location this facilitated ease in the collaboration to streamline access effectively. The American Job Centers provide an array of employment services to participants, as mentioned earlier in the presentation, where they are seeking to obtain, maintain, retain, and upskill individuals. Deaf individuals facing daily struggles to access the language, training, information, and to participate fully in the workplace and community. With the utilization of a smartphone, deaf participants will have access in our AJCs to video remote interpreting, allowing them to communicate with team members, engage in training programs and workshops. So in the Delaware AJCs, we have signage posted with a QR code to access VRI. On the screen, you're going to see a sample. Each AJC uses a cell phone to communicate with their participants. The deaf participants will scan the QR code and the conversation begins. With being co-located, our sister agencies, and having the signage available in the AJCs and VR areas, it continues to allow ease of access to the QR code for our colleagues and has been used by our client-facing team members, especially in the unemployment office. In 2024, the Delaware Department of Labor was hosting a month-long outreach, and DVR was engaged in this event, which was held in the community. We realized that access would be a challenge for the deaf and hard of hearing. Our colleagues turned to us as the vocational rehabilitation team to help deliver the necessary technical assistance for access. Recognizing the shortage of interpreters, this was an additional reason for our team member to continue the pilot of VRI. We have a focus to continue to increase access to all populations, and we have used this VRI service to enhance the services that we provide with our partners, vendors, and participants. We use VRI to provide technical assistance and show our commitment to serving individuals who are deaf and hard of hearing as we continue to improve access and ease concerns of a population of deaf or hard of hearing and the individuals we serve. Currently, DVR has 3 account subscriptions for VRI, and we monitor this monthly for usage and cost. So as you see on the screen, the sample signage is what we have posted in each of our AJCs, and these are on an 8.5 by 11 sheet of paper hanging up, and they're laminated. We also have them available for our outreach events that we attend throughout the state. So as you see here, there's the link for the QR code. If you do scan that, it's going to take you to the DVR page, as this is just a sample. Next slide. Oh, you can go back, sorry. So I just want to thank you for allowing me to share Delaware's experience and being here with you today. Please feel free to reach out, send me an email with any questions you have, and I will go ahead and pass this back to Sarah.
Thank you so much, Stacy. And definitely many people asked some questions while you were presenting. So I think that this is a topic people are very interested in. I really appreciate you sharing the work you're doing in Delaware. And without further ado, I want to move over to our next presenter, Robert Cooper. He is the Executive Director of the Kansas Commission for the Deaf and Hard of Hearing, KCDHH. Since 2014, Mr. Cooper oversees all KCDHH activities, including program of regulation and certification of interpreters in Kansas and border communities, and collaboration with other state agencies and political subdivisions. In his role, he advocates for communication equality and serves as advisory member on several committees and advisory councils within the state of Kansas. Mr. Cooper currently serves as president of the National Association of State Agencies for the Deaf and Hard of Hearing, NASADHH. Mr. Cooper has a 30-year plus experience in advocacy for people with disabilities, particularly those who are deaf and hard of hearing. Most recently, Robert Cooper worked at ESCOM in Raytown, Missouri, the manufacturer and distributor of two-way text communicator devices. Prior to ESCOM, he worked for Communication Services for the Deaf in Sioux Falls, South Dakota, moving through several positions in 4 years, starting as state director of CSD of Ohio's office and ending as the center manager for Project Endeavor Contact Center, a program involved with the U.S. Department of Commerce Broadband Technology for Opportunities Initiative. Prior to that, Robert Cooper served as executive director for 2 other deaf and hard of hearing related nonprofit organizations in Minnesota and Ohio. Other work experience he has includes working as a retail banker at JP Morgan Chase for 6 years and a brief time at Missouri's Commission for the Deaf and Hard of Hearing. Robert Cooper has a bachelor's degree in government from Gallaudet University in Washington, D.C., and resides in Topeka, Kansas with his wife and son. Clearly, Robert has a wealth of great information to share, and so I will hand things over to Robert. Robert, welcome.
Thank you, Sarah, for such a nice introduction. Hello, everyone. Good evening. My name is Robert Cooper. I'm the executive director for KCDHH since 2014. I grew up in Kansas, and I saw the implementation of this commission as a state agency in the 80s. And I saw its beginnings. And DHH was really cool because it used to be responsible for the coordination of service, setting up any, services that could address any gap, getting grants, and then being able to allocate funding to implement more services like interpreter referral services across the state. It's a very rural area, especially in Kansas City. So that was used to set up, a staff team of interpreters at the local hospital, to set up funding for employment services, to help with case management. That was a model they used to use back in the day. They don't anymore. But the idea was if they got money, they could then get services. I left Kansas, went to college, did some different career things. And then there was a job opening in 2014, and I came back to the state. And when I got there, I realized a lot of the services that I remembered were gone. We used to have, and some of the states still do have this, and they have brought this back. We used to have rehab counseling for the deaf or statewide coordination services for the deaf. Kansas has removed all of those types of programs. They don't offer those anymore. We're back to the beginning, back to square one. So when I came back to my home state in 2014, I had known what it had been like in the good days, and then saw that there were many gaps when I returned. I decided to figure out why. The models had changed, political climates had changed, challenges over the years had caused services to be cut. So I reached out to old partners and tried to dig into the history a little bit more. And it all kind of came back to a state law. Cuts and changes had gone on, but the state law had stayed just the same. That gave me the opportunity to ask, what happened? We didn't follow the state law. The state law had certain demands. What happened to those parts? Whose role and responsibility is supposed to be addressing these things? And so we kind of brought everything back to a centralized place. At that same time, we brought in the successful passing of the LEAD K bill, which is language acquisition for deaf children. That allowed us to set up an interagency where we could partner with multiple agencies at the state level, with schools for the deaf and other colleges in the area, to really just kind of centralize and make that shift towards building services and providing services like transitional services for deaf and hard of hearing people. We were able to help make those implementation of different needs for services like community services, employment services. State agencies were not in a place to create and operate those type of services. They had to contract out. And so after we started to create those partnerships with the Workforce Center and VR, we still noticed there were a lot of gaps. And it wasn't just in employment, it was also with services, with healthcare, with mental health care services. We were seeing gaps in lots of different areas that had pretty significant impacts. So we decided to try a pilot called the Communication Access Fund. It was a 2-year pilot. We wanted to see what would happen. And so we were able to collect data to identify the needs that we were seeing. Through that pilot program, we were able to see many, many gaps. And we had a very small amount of funding, but we were able to be very creative with that funding. We were able to provide services for job fairs, because who hosts job fairs? Sometimes it's a state agency, it's not very clear. Sometimes it's a community that's hosting it. Sometimes it's a religious organization that's hosting it. There is no consistency when it comes to the coordination of job fairs and who is going to make sure that communication access is given. Typically, you're given the runaround in those type of situations. Sometimes VRs can set up interpreters for a deaf attendee, but once they get there, they'll find out that there's other deaf attendees that don't have interpreters. So how do you get interpreting services for all these people? You can't share one interpreter. It goes back to the Communication Access Fund. We were just seeing if we could help bridge the gaps. It turned out to be very, very successful. We were able to find interpreters for job fairs. So let's say we have an interpreter for Monday, so that we're able to have everybody go on that one Monday without having to kind of get into a logistical nightmare. We were able to see resources. We were able to show that we're able to provide those resources. And so instead of the community saying, I don't know how to do this, I don't know who's going to authorize this, oh, the money, we were able to then just work out what we needed and focus on the program and services that were going to meet that gap. After that, we were able to step in as an advocate. Hey, how'd it go? What was the process like? What could you do to improve? How can we be better next time? Let me give you an example. It happened in a nursing home. Often planned care meetings, we'd have the social worker involved, we'd have the facility manager involved, the physician involved, but there was no communication access for the deaf person. So the deaf person is there, present in the meeting saying, I'm here, all right, but they had no say in their care. So we changed that, provided interpreting services to make sure that they had a voice. The bonus was after they made their informed decision, we knew where that deaf individual would go. And so we could follow up to see how they are getting services, to make sure that they are getting the services that they need. We were able to provide them with connection to their local service agencies, maybe with VRI services to get access in their nursing home. So we're able to collect the data from all of this and hand it over to the legislator. We had several years of data. And finally, $375,000 was invested to us. They said, KCDHH, you decide what to do with this funding. You create the priorities yourself. But they said half of that funding had to be allocated to the funding to courts or court-related services. And that could also then be used to enhance state services and partners. So some of that money was allocated to specifically be on deaf and blind services. So they had some stipulations, but we had half of that funding that we could then decide what we wanted to do with. Maybe focus on job fairs or service centers. We really wanted to focus on job fairs because it was a big space that many people could come to and get benefit from. Often we didn't know who was hosting a job fair because we'd see the flyer, but we're not quite sure how to contact them for access for communication services. And so we were able to kind of step in and get there to provide those services and bridge that gap and allow the state agency to kind of figure out, hey, look, we're here. You can tap into our service as needed. We had a great team that was able to show up with limited resources. California has so many cool things. They have the CAEDD. We don't have anything like that in Kansas. So we had to figure out a way to creatively work with people that provided those services because often they didn't know about deaf and hard of hearing needs. They just, worked with general populations. They didn't understand the needs of the disability community. Our challenge was that we had to provide that education, and the CAF was the vehicle that allowed us to put ourselves out there and educate the population. I'm confident that this will continue after the pilot term of just 2 years. Once we got the funding, there were some stipulations, like I mentioned. It wasn't like we were able to replace our budget with the funding that we got with that grant. The goal was to enhance or to improve the accessibility that we were providing. So sometimes in court, for example, deaf person needs a CDI, a certified deaf interpreter, in the courtroom. And the court says, oh, we don't have the money to pay for a CDI. That's where we step in. We're able to provide a CDI without any further requests or back and forth. We want to make sure our deaf participants have the access they need. We don't want to have the onus be on them to educate the court system. So we want to be able to make sure that we provide that advocacy and help provide the services that deaf person needs to go through their court system smoothly instead of putting the responsibility on them. We give the courts incentive to work with us, and then hopefully they see the benefit for working with us. We want other states to copy this model. We've had to reach out to different states to see what their ideas are and to pull that together into something that works for Kansas. Now, just next week, we have the NASADHH coming together to have their policy meeting in Kansas City. It's going to be happening the same time with the Deaf Senior Citizens of America Conference. That's happening also. So there's going to be 300 staff from 22 different states gathering next week here in Kansas. Really excited to see how we could get together, share ideas, listen and learn from each other. It'll be so beneficial. And so that's why I've come here to share our success with you all here today. I think I want to wrap up my part and give it back to Sarah. Thank you for listening.
Thank you, Robert. I really appreciate you sharing your expertise with us. And you also just a great wealth of knowledge. And I appreciate sharing the journey that you took in Kansas. So thank you so much. I am going to now reintroduce Tawny Leibach, who is going to share something that will hopefully help you. I know we've had a lot of questions in the Q&A box, and I look forward to getting to them, but around like, how do I support people? So I think Tawny is going to have a great tool. So I'm really excited for her to share that. So Tawny, I will hand it back over to you.
Great. Thank you, Sarah. So today is just scratching the surface of the wealth of things that the states are doing currently, both previously and currently. I know that there's some chat happening right now about different ideas to apply in your future work. Now, ODEP has some great resources that we provide. We partner with the Employment Training Division, like you saw Lamia mentioning in her part. And we partner with the US Department of Labor. And ETNA has a great website called the Workforce Gaps, or GPS, excuse the interpreter. You can look at that website. They have a variety of resources and information that they can share with you. When I first started my White House Fellowship here at the US Department of Labor, I learned about the different resources and information that was available. I myself, as a deaf and hard of hearing advocate, didn't even realize was available at the American Job Center. There's 200 to 300 resource centers across the country, and everyone, including deaf and hard of hearing people, can take advantage of that. The Workforce GPS website that I mentioned is really cool. Again, it has a lot of resources, including information related to communication access. When I looked over this, I kind of was figuring out what we needed from feedback based on other webinars and things that viewers have mentioned that they need. I reviewed all the feedback and I see that we need more visual-led guidance for communication access tools that both are modern and up-to-dated. There are a variety of options out there. Also, people want to know how to increase outreach with different valuable agencies and organizations in their community. It's hard to do that work alone, to figure out solutions on your own. And that's why we here at the US Department of Labor encourage collaboration and creative problem solving, including the BBS. Grading services, making sure you can sequence services, merging services so you can provide a wraparound services. Sequencing of services means that once one agency finishes their part, they pass it on to another agency so that that consumer can get wraparound services, whether it's financial, independent living, medical, informational that's exchanged. That can also include interpreting services or other type of communication access. It does not only come down to interpreting services. Deaf and hard of hearing people have a variety of ways of communicating. So I want to give you a glimpse of the new tool tip sheet that we'll be sending out after the webinar that you participants will be able to give feedback on, and then we will disseminate nationwide for people to use through the Workforce GPS site. So there's two parts that we'll be touching on. The communication access tools. We'll talk a little bit about what's modern and up to date to help give you some things to think about when it comes to picking the appropriate tool. Second, we'll talk about the outreach. Next slide, please. We'll be including icons in this slide, and the icons represent different opportunities. So like you saw, our 3 great presentations today, there's a lot of opportunities for technology and access and tools and variety of resources that we might not have had in the past. For example, we have handheld devices like your phone, your iPad that can then connect to an interpreter instantaneously. You can use captioning features through your device. You can connect through Zoom or Teams or any video conferencing toolkit or platform, depending on the company and the access that you use. Sometimes people will use separate devices to connect to those tools. That is all covered under the federal video relay services. But for in-person interactions, you can use video remote interpreting with your own device. That, though, has to be paid by an organization or a company that is going to be contracting with that interpreting service. Let me see what else on this slide. I want to emphasize that the law says, specifically the ADA, it's the 35th anniversary this year. It's a really great, unique opportunity to really celebrate the ADA. Without the ADA, all these presentations might not be as enticing or as sophisticated as they are today. So we really are grateful for the ADA and all the people that have been involved in passing that 35 years ago, and all the people that have been making sure it is upheld up until now. the ADA emphasizes effective communication and accessible communication. That means that it's really up to that person, that deaf person, the deaf blind person, the deaf disabled person, about what they need. It's not a one size fits all. So always ask and check with that individual what works for you, right? And what they might need might change over time. So please ask, make sure that you meet their needs, because it creates a lot more access in the long run. With technology today, there are a lot of technology options that you can use, but a situation will denote what you should use. And again, it depends on what the client is saying is their preferred communication access need. And it also depends on the situation. So ask and also take into consideration the environment. Whether it's technology, whether it's in person, cost always comes into the picture. I encourage you to look at different vendors and companies that provide different types of services within your state or nationwide. Do research, check into it, make conversations, and find something that works well for you. Check into the company. Do they have a background and a history working with deaf and hard of hearing people? Do they train staff to have that empathy? Do they have staff that have lived experience? Check into those companies. Check into their policies. Can you get interpreters at a last minute request, or do you need to wait for 24 hours before you're able to get an interpreter? Figure out what it is that you need and then research what companies offer so that you can make sure you get the best fit needed. You want to make sure that you have someone that a contract that you could perhaps get an interpreter right away for a deaf individual that comes in right away. Make sure you think about the protocol in your particular office. That gives you an opportunity to check in with your deaf and hard of hearing consumers to see what it is that they need. Maybe you don't have any coming into your center. This would be an opportunity for outreach, which I'll talk about a little bit more later. I want to make sure I've covered everything on the slide here. As you saw today, it's important to disseminate information through a variety of channels, your website, social media, old school flyers. Different channels helps, on your website, like I said, putting it very explicitly on how to reach out for more information. The more you put your information out there, the more you'll bring in consumers that need the services that you provide. Next slide, please. I want to talk a little bit about outreach. Outreach really means collaboration. How can we really pool our services and resources and information together to benefit everyone? You've seen different examples of 3 different state agencies here today. All of them have really fabulous places and supports that they provide. Typically, they get funding from the state that focuses their services on the deaf and hard of hearing communities. If you're curious about what your state offers and what agencies might be available in your state, you can look whether there's an agency or an office or a commission on deafness and hard of hearing. There are different names typically used within different states. They're typically there for you to ask questions and get more resources from. If you want to find out who it is that is doing this in your state, you can look at this website. The NASADHH has a list of different organizations nationwide of state agencies for deaf and hard of hearing service centers. If you click that link, you will see a list of different members within different states that you can reach out and perhaps start that conversation with, or maybe you'll see some familiar names. I also want to remind you all to think about the youth population and provide support for those youth that are looking for a job, especially under WIOA. You can look for the Conference of Educational Administrators of Schools and Programs for the Deaf, Inc. You can see a link here on the slide. This organization's been around since the 1800s. They provide different outreach and support for different administrators of schools and programs for the deaf. Reach out to them, click that link, see who's available in your state, in your region. Reach out, see if you can develop a relationship with their CTE program, their career transitional education program, for example. or their superintendent. Reach out to them. Reach out to their outreach office. A lot of schools have statewide services that they do provide. So try to figure out how you can connect with that local school district to provide support or coordination. Maybe that school district already has a teacher that knows how to interact with their local job center. They could perhaps give a tour, or you could give sort of a collaborative way to expose the deaf and hard of hearing youth to the services available in your state and the job centers available in your state. Third, of course, is vocational rehabilitation counselors. They are an important part of this puzzle. VR counselors give the coordination that perhaps schools or state agencies cannot give. So they're able to really connect the dots and provide a really high quality of service. Like I mentioned before, you have to think about how braiding, blending, and sequencing can work together. How we can really connect the dots and be creative to make sure that we think of providing effective communication access for all the individuals in this population. Once we provide access to the deaf and hard of hearing job seekers and increase their opportunities, we will definitely see a ripple effect for other populations. The ultimate goal here is to make sure that everyone is able to find a good job that they feel excited about and feel inspired by, so that they can succeed in their own lives. We'll have many great questions. I'm going to go ahead and bring Sarah back so that we can get started on that question and answer session to hear from our different presenters. Thank you again for watching today, and keep your eyes out for that tip sheet and other resources that we share after today. Thank you.
Thank you so much, Tani. I think that's really creative and great and helpful, and I look forward to when we'll have that available. So we did get several questions from the audience, and I think that's great. And I hope we can answer as many of them as possible. I'm within the time frames, and I know many of our presenters answered questions throughout the presentation, but because not everyone can see them and they're such good questions, I think we should still talk about them. And so one that I specifically thought was really valuable, and different people ask this in different ways, about training and supporting AJC staff to be more responsive and confident when working with deaf and hard of hearing customers. Also thinking about best practices. So I think, David, if I know you, since you work directly, I wanted to hand it over to you, but to all the presenters, what kind of advice would you give in that area?
This is David. Thank you, Sarah. I did answer the question in the Q&A, but I'll go ahead and answer it again in sign language because I feel like it's important for everyone to see this. So I work in this office, but there may be some states and some areas or regions where you'll be working within their deaf and hard of hearing center. That's not something we do. Our contract requires that we are on site at least 3 days a week. So I have a wonderful time building a relationship with people in this space. We often have stand-up meetings where they'll basically discuss different things on the agenda, and I always participate in those meetings, especially when we have new employees. I like to come and give a brief presentation, kind of like I did today in my presentation for you. I talk about the programs and services that we offer. We also do education, not just here, but out in the community. Not just working one-on-one with the consumers and helping them look for a job, but we also help them with networking for employers. We're a part of that process. We will go either ourselves with an interpreter to do that presentation, and then we allow the deaf consumers to have that one-on-one with the employer so that they all can learn about the services that we provide. We have a brochure that we like to give out. This is the old one. We have a new one now, but there are different brochures in that. And we're actually in the process of revising them to become just more modernized and updated. So one example is our employment services and what it looks like. It's this right here. And it has a QR code on the back. That's now the thing, QR codes. That links to our website, and then that encourages people to join in our programs and services, whether they're an employee or an employer. We also have an agency brochure that we give out to our visitors here as well. See that here? It's a different one. And we also are developing, and we're in the process of revitalizing this because this is old. We've gotten rid of some of these things, but it says here, strategies for communication effectiveness with deaf and hard of hearing peoples. So we basically provide a summary of different communication tools and different languages and different functionalities that, our consumers use here in the office. We also list out some common questions and some misconceptions about deaf people, how to communicate using an interpreter, how to communicate with a deaf person without an interpreter. So we have a variety of scenarios that we try to educate on. And when we give out these brochures like this, we always follow up a couple of days later to check. Do you have any questions? Would you like us to come out again? Also, after a person is hired effectively, we will tell the employer, hey, I'll give a presentation typically about 60 to 90 minutes in the workplace to give them some background information on deaf culture and deafness and how to communicate with their new hire. We like to be there on site to answer any questions from the staff. Sometimes it's just the managers, sometimes it's the staff, sometimes it's everyone. For example, one time I went to a place and I talked to probably about 200 people at once. The key here is education. If I could come down to a keyword, education is so important. And kind of related to that other question, the carrot and the stick approach is important. Sometimes we'll tell them, hey, you need to provide the interpreter, let's say for Target or McDonald's, big companies, they can easily provide interpreting services themselves. So we use that as being like, it's your responsibility to provide that. But sometimes we'll use the carrot method, like Robert says, and we'll just bypass that whole model and just provide the interpreter ourselves, because then it shows the employer, look, this is how you do it. And then we kind of go back in and reel the employer back in and say, hey, so we provided the interpreter this time, but you have to provide it from here on out. So we make sure that we satisfy their legal obligation under the law to provide access and equal communication for their employee, their new hire. Thank you.
Thank you, David. Did anyone else want to also respond about supporting job centers? Okay, well, we also received, and David, you just did such a great job on that. Thank you. We received several questions about paying for this, paying for video remote interpreting, paying for communication services. And I know both Stacy and Robert answered some questions, but I thought I would leave this open to you. So some people asked, what is the cost of video remote interpreting? And how was it paid for? And so I thought, Stacy, if you want to give a little bit of answers about that. And then Robert, I thought maybe if you could touch on the idea of securing that long-term funding for the Communication Access Fund.
Okay, so yes, we've had some questions about the cost. So the selected VRI company that we are working with, it has tiers. So the tiers average with the minutes used and the pricing. So the one we have has 6 different tiers, and we use a tier 3, and it is $11.49 a month. So that's $1,149 a month, and the tier can change monthly as needed. So what we do is, I noted in my presentation that we monitor that monthly, with our spending, so to see where we're at. And it really just depends on the demand. So monitoring that is important. It might be certain times of the month or certain times of the year that we would have more or less need for the on-demand service. 480 minutes are the average usage for this tier 3 that we currently use. Any other questions around that, or did I answer all of your questions?
Thank you, Stacy. Go ahead, Robert. It's on you now. I was just about to say that.
Hi, this is Robert. Yeah, I wanted to add. So KCDHH has a VRI RFP going out soon, but we've been also looking at two different models from two other states. They happen to have staff interpreters ready to use. So we thought maybe we could have an idea where we schedule that staff interpreter to give support for VRI hours during peak time if they're not scheduled for work. That way we save the cost of interpreting on the cost of interpreting services. If they are full, then that could then perhaps be routed to an overflow VRI company. If they're not full and busy, then it goes back to that staff interpreter. So then we're, using our interpreting services more wiser and reducing costs overall. We're trying to figure out how to have that work well here. I'm sure other states are figuring this out as well, but that's just a thought that I had based on things I've seen in other states. Thank you.
Thank you, Robert. Okay, so we're getting close to the end, but there's one more question that someone asked, and I just think this is a really great question, and it's something that, I know personally from working in job centers is so important. But if you could all respond, Stacy, Robert, Tawny, anyone, what are the biggest takeaways for other states who want to build similar partnerships with community-based organizations? Because we know partnership is so important.
Hi, sorry, I was having trouble. I would say connecting, right? Having those genuine conversations with those partners and try to as was shared before, like, we want to braid services. We want to share you know, questions, concerns, things that are coming up. And, when you put the topic out on the table, try to collaboratively, identify strategies or solutions and how things can work. I know, there's a lot of subject matter experts out there, just like that's on this call, and being able to reach and talk through some of those processes. So that's some of my thoughts.
Thank you. Hey, Robert, go ahead. Sorry.
This is Robert. I'd love to add in terms of partnerships. So I used to work as a banker. And during that time, I learned the value of building relationships and building rapport and how important it is to understand where the client is coming from. And that client could be a business entity, whoever it is I'm meeting, I want to make sure that I'm able to meet their needs, right? Identify the gaps, make sure they feel comfortable to talk about those gaps. And often clients are resistant, right? They may be feeling worried that they are in trouble, they broke the law or something like that. So we want to make sure that we put them at ease. Say, hey, do you know that we have these resources? And typically, if people are being given solutions, they're going to want to work with you. And that's how you build relationships. And so sometimes I'll ask for something else in exchange. Hey, could you help me by helping get your story to the legislatures? Could I highlight these things with other people so that I know that I can make those connections? It makes my job easier. I'm achieving my own goals, but I'm also helping other people achieve their own. It's reciprocity, and that's really important in a relationship. And I value that and keeping that going and never stop with that reciprocity. You can see the rewards come. Thank you.
Thank you, Robert. Tawny, yeah, would you like to finish us up here with this question?
This is Tawny. Yes. So rewards are very, very high in this space. The unemployment rate for deaf people is about 38%-ish. That means that over 40% of deaf people do not have a job currently. So that means that there's a lot of opportunities to serve this specific population. And often with lack of knowledge or just not being sure what to do, that then becomes a barrier in and of itself. So I hope that this webinar gives you all some things to think about on how we can really shift that narrative and make sure that we are providing communication access and as a result, providing quality employment opportunities and then providing opportunities for deaf and hard of hearing people to contribute back to society. We want to figure this out together, and I really appreciate your time today and being a part of that process. Thank you.
Thank you so much, Tawny. I really appreciate that. So we're getting close to the end, wrapping up, but I just have a few more things I want to mention before we say goodbye. Next slide, please. We have so many great things on the Lead Center website at leadcenter.org. Really quick, I want to point out one that I think you all will find very valuable. It's called the State-Specific Policies and Data page. And it's one website I can almost guarantee you will want to bookmark and save. It's pretty much a one-stop hub where you can find up-to-date state-specific policies, initiatives, and services, all to better understand how a state or U.S. territory supports opportunity and participation for people with disabilities. So whether you're looking for specific data points or you just would like to learn more about how your state is supporting opportunities for people with disabilities, highly recommend this page. It's a great place to start. So I just encourage you to visit the page. They have a drop-down menu where you can click on the state. The navigation is pretty simple and it's updated regularly, carefully curated. So I highly encourage you to check out the page. Next slide. And while we're at it, I can have to remember to encourage you to please, if you have not already, subscribe to their updates on the Lead Center website. When you subscribe, we'll notify you about upcoming events. You'll receive updates on when archived recordings of the webinars, like the one we had today, are available online. And while you're at it, you can also subscribe to our newsletter. It's a really great way to keep up with everything that's happening at the Lead Center. And of course, another great way to keep up, next slide, is to follow us on all of our social media pages. We will always be able to give you the greatest updates and latest updates there as well. So with that said, next slide. Thank you so much for joining us on today's webinar. I know I learned so many valuable things. I really want to thank the presenters again for sharing their expertise. And I hope that you all found this valuable as well. Thank you so much. Have a great rest of your day.